So I just wanted to first welcome you all here and say good morning. My name is Laneceya Russ, and I'm the Executive Director of March for Moms. For those of you who are new to March for Moms, we're a nonpartisan, solution-oriented 501c3 nonprofit that aligns the diverse voices of families, physicians, healthcare providers, policymakers, and partners to advocate for mothers and families' well-being and equal access to care. I'm so excited to have you all in person today. This is our first time doing this workshop in person. We were virtual last year, and we will be focusing on elevating community-led solutions for postpartum support. And today we will be featuring 5 community-based nonprofit organizations and highlighting and amplifying their innovative programs that serve moms, birthing people, and families. The work that community-based organizations do each and every day to improve outcomes for moms, birthing people, and families is evident by the nearly 200 of you all who are joining virtually, as well as those of you who are in person with us at the library. March for Moms has made a commitment to uplift and highlight the work that community-based organizations are doing and providing a small group of community-based organizations with support through our Impact for Families program in partnership with Maven Clinic. And we have 2 of those organizations here today. And we will be kicking off today with remarks from our keynote speaker, Representative Marjorie Decker. Marjorie Decker is currently serving her 5th term in the Massachusetts House of Representatives, representing the 25th Middlesex District. Before joining the House, she served 7 terms on the Cambridge City Council. Growing up in public housing in Cambridge, Representative Decker was the first in her family to graduate from high school. She graduated with honors from UMass Amherst and earned her master's degree at Harvard's Kennedy School of Government. She is known for speaking truth to power and has a history of filing legislation on poverty, civil rights, affordable housing, organized labor, early childhood education, and the environment. Representative Decker continues to be a champion for vulnerable community members due to her leadership. Massachusetts was first in the nation to protect access to earned income tax credit for married domestic violence survivors and had progressively increased the state's match rate from 15% to 23% to 30%. Representative Decker has also worked to increase cash grants for families with children, elderly, or disabled members over the last 3 state budgets, when prior to that, the grants had not been increased in decades. Several pieces of legislation that has been enacted by the legislature and signed into law this session included language filed by Representative Decker from her bill to establish a statewide standing order for emergency contraception to her bill to transition the Commonwealth to 100% renewable energy to her bills addressing children's behavioral health. Patient protection legislation that she filed to reform step therapy or fail first policies was also recently signed into law. Representative Decker is House Chair of the Committee on Public Health for the 2021-22 session. Let's welcome her to the stage.
Good morning, everyone. I want to thank you for asking me here, and my colleague, who I know who's been working with many of you for years at the federal level as well, Representative Laneceya, who asked me if I would come in. She sends her warmest regards to you. Thank you, March for Moms, for the work that you're doing. I'm going to read in between. I'm not really good at reading things that get written for me, so I'm going to sneak at it because some of it's important to make sure I don't lose. But really, having voices that talk about what the maternal health journey looks like and what moms need across the nation. Nobody else is talking it except for us, right? So if we as women and mom and birthing people aren't talking about it, it's not going to happen. So I want to thank you for having me here. I have a long history in my community in Cambridge of strong advocacy prior to having children of supporting and trying to uplift our own what is a standalone birth center in Cambridge. And in that birth center, I got involved because we were looking at closing a portion of that down, the services down, and it was the one that was conveniently across the street from 2 public housing developments, and it also had the highest number of users were also immigrant families who were using that. And so that is really what introduced me to this work around maternal health. Little did I know that many years later, I would be looking to this same place to give birth to my children. So I'm also, in addition to all the things that you've said, one of the most challenging roles and most important roles is being a mom to a 14-year-old and an 11-year-old who's about 25. And I will just say that every day I feel like she's winning, and I'm just keeping my head above water. So some of the stuff that I'm going to share, you already know, which is why you're here, right? It's either through lived experience, and it's what also brings you to this advocacy work. We know that across the nation, that Black birthing people are 3 times more likely to die in the birthing process. Well, in Massachusetts, which is the mecca of innovation in healthcare, that statistic's not that much better. It's 2 times. We know that regardless of your education, your income, your zip code for Black birthing families, that statistic doesn't change. That's alarming, and it really needs to be a front page story on every major newspaper until we change it. But that's why you're here. You're here to make sure that that we don't actually flip to the back of the paper to read this, and that people in leadership and positions are listening to moms and birthing families on the ground, in our neighborhoods, in our state houses, in our city halls, in our hospitals, and supporting the providers who actually can make those statistics look vastly different. So when I talk about the what does it mean to actually provide support and the kinds of support? Well, when I think about postpartum depression and anxiety, right, we have a very abysmal statistic on how we screen moms for that. And I go back and I think about my own birthing story. And I think about I had a really tough pregnancy. My first pregnancy, I was losing weight my first trimester, the whole thing. The first time in my life, I was not excited to lose weight, and throughout that, and ended up not having the birthing experience that I thought I would have. It became an emergency C-section. Those are some big red flags. And yet, even for me at the time, a city councilor, a white woman in a hospital that knows me, they still weren't flagged to think through, the screening process of postpartum. So like many, many women, I just slugged through it and worked through it, and then got to the other side. And I was fortunate because we know that many families and many birthing people can't get to the other side without more support. And in fact, it becomes a spiral on them and on their children and on their families. Recently, I had the incredible opportunity to chair, or to really shepherd, more like it is, this process that the Massachusetts legislature began over a year ago. My colleague, Representative Liz Miranda, who's now going to be Senate-elect Liz Miranda, worked with advocates on the ground and families through their lived experience to call a commission together. And our sole job was to look at the racial inequities in maternal health. And it meant that while many people who are on this commission understood what these statistics meant because they were living them or they were in the healthcare system, what we really did was provided two things: a truth document, so that for anyone who says, well, I didn't know, particularly lawmakers and people who are in positions to create change, and it's not just in the legislature, it's to our hospital CEOs, it's to our doctors, it's to our nurses, it's to our families, right? That we now have this document that says, yeah, this is how bad it is, that regardless of your zip code, your income, your education, your profession, right, that Black birthing families and babies are actually being harmed at an alarming rate, in which we know that the majority of that harm could have been prevented. One, if families had been listened to, had been believed, and we find a systemic way of actually tackling the systemic reasons that racism permeates all of the institutions and systems that actually enable that startling statistic that we can change. I mean, that's the good news, right? I mean, the good news is that where we are today, it actually doesn't have to be that way, and it's not. It happened because of choices, poor policy choices. It happened because at the root of it, I will go ahead and say, because at the root of that is around misogyny and racism. So if we know that, and we now have this commission report that actually lays out all the things that we can do, we have a document to also hold us accountable and also to build a roadmap. Where do we begin? So I could not be more proud of the commissioners who really, they are the ones that did this work, and it really was compiled of doctors, doulas, midwives, birthing people, and advocates who did the work, and our job in the legislature was to give them space and the tools and the resources to produce this document. So moving forward, I think about this document, and I think about, and I remind people, a legislative commission, and this is because you're a national organization, a legislative commission and a legislative report, it's not legislation. It's not a budget. It's not regulations. And so what we do now is now the work really begins, that we actually make these recommendations come alive. I have two colleagues who are in the House that I'm really excited to work with, who've been already doing this work. But what we are doing in my office through the Public Health Committee is really uplifting them and providing them the support and the staff work to take these recommendations and to really launch them as legislation. And I will be right there beside them, advocating for these changes at the legislative level. And because this topic is really about postpartum health and support, I also have to tie it to what are the other issues that go into supporting families and birthing people and women. And you can't talk about maternal health and postpartum health without talking about racism and without talking about the social determinants of health, right? If somebody is housing insecure or homeless, and if somebody is food insecure and hungry, and doesn't have economic security, well, then we know that the mental health outcomes for all people, not just birthing families and people, there's a direct correlation there. The more we tackle those social determinants of health, make sure people aren't hungry, they have a good place to live, and that they have cash, right? And I'm going to say cash is key, because cash is not a substitute for all the other kind of wraparound services. When families are empowered with cash and money, either through the value of their work and their jobs, or through government programs, which that cash is meant to be used to stabilize, then we know, in fact, you see the rates of mental health disorders actually go down or not be as acute or be addressed. And that's not to say that that is the solution to everything, but we do have to start looking at and understand what actually pulls all of us into becoming more clinicalized when it comes to dealing with our mental health and our anxiety, that it's not just a coincidence, that there's a lot of factors outside of our control, but that, again, the good news is we do have the ability and the tools to change those factors. It's, I say, if you read my Twitter bio, which honestly I'm still deciding whether or not to delete it, and so we are in the process of archiving it. It's, like many of you, probably complicated, but in my bio it says, poverty is not an identity. It's a choice of policies and budgets. And so I think that also goes to when we talk about the kind of support that families and birthing families need when it comes to understanding how do we not make this inevitable. Because some of it may happen, but how we address it and how long-term and how acute it is, that's not what's inevitable if we actually provide families with the tools. So like I said, I had a whole bunch of things written here, and my staff was like, we worked hours on those slides. But I really think it's about understanding, so I'm going to talk about where do we go from here. Well, one, it's recognizing, you're going to hear later from one of my favorite people who is the founder of Vital Villages, right? So, and if you don't know her, she's going to be one of your favorite people, like within 5 minutes of her talking. So it's about supporting the work that's happening on the ground, and it happening in our hospitals, that's engaging community. This commission that I had the fortune of really shepherding and chairing as the public health chair only happened because it happened on the ground, and it was a coalition of people and individuals and sheer determination and partnership that made that happen. I'm very excited to see where that work's going to go. We have a lot of other things that we're still trying to do, and it's going to require a lot of other support and organizations. I think of there's this amazing academic group that's based out of Tufts, but Mother Lab, right? Dr. Ndidi, you may know her. But I also think about, I didn't know her work until I started doing this commission. And then I started probing, because that's what I do, I probe. And I said, who's paying for this? Is Tufts paying for this? Oh, Tufts is not paying you? Oh, how amazing for Tufts University to be able to have you housed there and certainly have a lot of credibility. And you know that they use that and that feels good for all the right reasons, but how are they not supporting it? So part of the work for me was to say, okay, so part of this work is about saying who should be funding that kind of a research lab, right? Should it really just be left to, quite honestly, women and Black women to find their own funding to research and give us data and solutions on something that is a societal systemic problem? So I'm really excited to keep working with them about figuring out how do I then actually, at least at the state level, invest state resources. I think of the amazing work that's being done at DPH. One of the commissioners, this amazing woman, Dr. Fifi Job, who has I could sit there and listen to her, and if we just kind of like started taking what I think is quite honestly some of the low-hanging fruit, and that's to say that her work is not low-hanging, to be very clear, but some of the solutions that she has put before us and sort of how we look at data, how we collect data, how we translate it, where it goes, it has to be a priority of collectively of those who are in positions to make those kind of changes. And so, again, I guess I'm here with you today because you are a grassroots organization that represents, families across the nation, that's speaking truth to power, that's demanding justice and demanding equitable health care for all of our families. And I do say that when I promise when Black birthing families and moms are thriving, we all will be thriving. Everyone else thrives. It is that tide that lifts all boats. So part of that is about recognizing the organizations and the people, whether they're in your community, they're in your own state agencies or municipal agencies, and uplifting and partnering with them. Because the other part of this is that being an advocate alone, as many of you know, which is why you are here together collectively, and some of you are even have come all the way to Boston to be part of this in Massachusetts, is that collectively finding people to connect with, link arms with, uplift, and collaborate with is really going to be the way we continue to change the tide, to change the statistics, and to really not just talk about caring about health equity and racial disparities, because there are pockets around the country where that's talks happening all the time. You can't get in the room unless you're willing to talk about that. Now, I understand that's not everywhere, but even the pockets where it's happening, talking about it isn't going to change policies, change regulations, and change budget priorities. So how do we make sure that the intersectionality around that actually happens? And I will just say that my life's work has been about taking my own lived experience, having grown up in poverty, having family that still lives in poverty, still lives in subsidized government housing, still struggles with hunger, still struggles with mental health issues. And I feel very fortunate and blessed to have this lens to know that a lot of those struggles are not because of any deficits within them. They are systemic, and I've seen it. And when we change those resources and we change the systems and we demand to bust up the systems and get new people to design them who really understand what inclusive would look like, because the outcomes would be different, then we actually are doing the work that I think all of you are called to do and why you're here. There are a number of things that I was going to share with you in terms of initiatives, legislation. I will just say this, because I know you have an incredible day ahead of you. Some of the other bills that have come through my committee, and some of them I have helped lead, but understanding how do we really support doula care? How do we make sure doula care and midwifery care? So we've had two standalone birth centers in Massachusetts that have been struggling. One is actually taking on the challenge to stay open. The other one has chosen to close. And initially part of that conversation was, well, it's only white suburban women who are using it. And when we try to sort of have an equity conversation, I say, well, let's be clear. Women across the board are not faring well in maternal health, period, regardless of race and regardless of income. Now, some are faring much better, but overall, as a country, we really need to be doing much better for birthing people and women across the nation. Secondly, if in fact we know that, and I can go back to this report, that some of the recommendations are that we already know that Black birthing families and babies are not safer in our traditional hospital care, right? Statistically, they're just not. Then why wouldn't we work really hard to actually not dismantle the places that are actually supporting and that the statistics and the outcomes are better for healthy pregnancies? And so I think about legislation that's been before us to support midwives, to support doula care, to expand that, to make sure that there's a pathway to expand the workforce so that it is more, so that every birthing person can go find a doula or a midwife that either looks like them, relates to them, speaks their language, like whatever it is that needs to make one feel secure and safe. And we also know that, and again, I'm speaking to people who already know this, we also know that when birthing people actually have an OBGYN doc that it looks like them and is a person of color, the statistics actually show us that there's a different outcome too. So it's not just a feeling, it's statistically a reality. So I think about the bills that have come forward that I've been working on for 8 years now, trying to look at how we, in fact, can ensure that people who are doing breastfeeding care can get reimbursed by insurance companies and not have to do a workaround. And that has been mind-blowing to me, what a struggle that has been in Massachusetts. And as somebody who really struggled with nursing, you want to talk about postpartum care, and for me, I left the hospital and didn't realize at the moment you left, they were no longer responsible for whether or not you could nurse. And I had the most amazing care team of midwives and an OBGYN because I had to have an emergency C-section after 4 days of being induced and in labor, right? So there was nothing about this birth that I thought it was going to be. And then to go home and find out it was really hard to nurse, well, I can tell you, again, there were so many flags where I should have been flagged for having postpartum depression and anxiety. Didn't happen, slugged through it. But we need to do more around creating access, expanding access, and making sure that, quite honestly, it is as accessible and that money is not the barrier to getting that care. So when we're doing those things at a multi-level, then we really are saying we honor. Then we can be a country that really talks about honoring families, honoring children, honoring moms, honoring birthing people. So I really am just here to say welcome, and more importantly, thank you for the work that you do. Your work, your advocacy makes it possible for people like me, Representative Balcedo, my colleagues who will be joining me more in this work, as well as legislators across the country. Like, we stand on your shoulders. So the taller you rise in this work, the higher we can actually get to reach to create those changes. Without you, we can't do that. With you, we're not only empowered to do that, but we are called to action and held accountable to do that. So thank you for all that you do, and really it's an honor and a privilege to be here with you today.